I'm always and have always been someone very interested in solving puzzles and kind of answering very difficult or challenging questions, and I think this field has given me a host of those. The Eating and Weight Disorders program is a center of excellence here at Mount Sinai, which means that we do both cutting-edge clinical research, but also provide direct care to patients and their families. We see kids as young as 5 or 6 years old, adults into their 70s who are struggling with these problems. We see folks who have problems not putting on enough weight, who are really low weight and struggle with effects of starvation, all the way to those who have a weight in excess enough to even consider getting surgery. Our primary specialty treatment is psychotherapy. We're probably best known and best at delivering family-based treatments for these problems. Anorexia nervosa has the highest mortality rate of any psychiatric illness. When I first began, the initial instinct, particularly for anorexia nervosa, was to isolate the individual from their family and to blame them as being the cause of that illness. We've come a long way to believe that that's absolutely not the case anymore, and that the family is actually essential to the recovery of individuals who suffer with this illness. What I hope for our patients is that they're able to put their eating or weight problem behind them and redefine their life in a way that puts distance between them and the problems that they suffered with.